Updating tonight's top stories, Singapore further tightens COVID border controls. There are new restrictions for long-term pass holders and visitors travelling from India. A stop work order issued at the construction site where 18 workers tested positive for COVID-19. 17 of them had earlier recovered from the disease. And for a closer look, we're joined by Infectious Diseases Physician, Dr. Ling Li Min. Doctor, thank you so much for joining us. Firstly, Dr. Tan See Leng said that the NCID will need more time to establish if these are prolonged shedding from infections or if they are reinfection cases. Which is more concerning for you?
Well, reinfections would be more concerning because what this means is that these patients, they had recovered, their immunity had waned, declined, they became susceptible, they got exposed to a COVID person or case, and they got reinfected again, a new second infection.
Dr. Ling, an added measure that's been done is that the workers in the construction, the marine, the process sectors as well, they're all going to be back on so-called routine testing once they pass 270 days or 9 months after their infection. Could you put it into perspective for us? Why 270 days?
Yeah, so there have been studies which have indicated that a lot of the natural immunity from COVID infections itself could last up to 9 months. So beyond this period, these people that have recovered would be equally vulnerable to getting a new COVID infection. Hence, I think this is why beyond that 9-month period, they will be re-rostered back to do the RRT.
And travellers from India to Singapore will have to serve extra 7 days apart from quarantine. That makes it an extended stay home notice of 21 days in total. How useful will this be in detecting those who might have fluctuating or low viral loads and prevent a possible transmission?
So the incubation period for COVID infections generally is about 14 days. By extending SHN to 21 days would mean it would allow us to be able to detect every possible positive case, including the ones with fluctuating low viral loads.
Dr. Ling, talk to us about the efficacy of vaccines, because the current vaccinations that we're having, they're expected to be able to last for approximately 15 to 18 months. But the actual makers of those vaccines, Pfizer and Moderna, they've indicated that a third vaccine dose is likely needed. So what considerations need to go into deciding when a booster jab might be needed?
Yeah, so the figures you've quoted there, it's very optimistic figures. So I'll just explain that for the mRNA vaccine, the first dose is essentially to prime or trigger a first immune response, yeah? The second dose actually, that's given about 21 to 28 days later, depending on which vaccine we sign up for, is actually, in a way, a booster dose because it actually enhances the initial immune response, yeah? So at this point in time, there are observations made that with respect to the mRNA vaccine-induced immunity, it could last up to 6 months, okay? We're hoping for more than that, but we've got to wait for more data to come along. So if there is going to be a third dose, when is that best given? Probably best given at a point in time before the initial vaccine immunity wanes to extremely low levels, or in a situation whereby we have a new strain whereby the original vaccinations are no longer effective against. So I think these are the situations whereby a third dose may need to be considered.
All right, Dr. Ling, thank you very much for sharing your perspectives with us this evening. That was Infectious Diseases Physician Dr. Ling Li Min from the Rophi Clinic.